Food oral immunotherapy is a way to turn off food allergies in our most allergic children and adults. Patients allergic to peanut, egg, milk, wheat, or almost any food can be desensitized through food oral immunotherapy. This offers an opportunity for a patient to safely be around and even eat the food. Food allergy is not only a risk of anaphylaxis and a risk to your health, but it's a great burden to families. Children are often isolated at school, at a peanut-free table, and it affects their life in all sorts of ways, not only their own, but other members of their family. We started offering food oral immunotherapy to our patients here at Windom Allergy in 2012. We started with milk, patients with milk allergy. We've done peanut, egg, and a few kids with wheat allergy. And this is available for kids and adults. We don't start milk and egg until about age 8 because children will often outgrow this allergy on their own. But they're still having the allergy by 8 or 9 years old. It's more likely to be persistent, and it's worth turning it off with food immunotherapy. Patients with peanut will start as young as 5 years old, since this is more of a lifelong allergy and they're not going to grow out of it on their own. Studies on food immunotherapy have shown it's effective in about 60 to 80% of the cases. Some children or adults will withdraw due to the inconvenience of taking the food every day. Some will have mild or even more significant reactions, at which case we have to back the dose up, and then they may want to discontinue. So for various reasons, some will stop, but it's been effective in a large number of patients, and they're allowed to progress up to a full serving of the food, and that would be 1 egg, 1 glass of milk, 2 slices of wheat bread, or 8 peanuts. So when a patient comes to Windom Allergy to ask a question about their food allergy, we'll go through their history, we'll do skin testing, as well as blood tests to confirm they're allergic to the food. And if they are, we can then offer them the opportunity to build up their resistance to the food. Patients must continue to stay on a daily dose of food, be it peanut, egg, wheat, to continue to maintain their decreased sensitivity to the food. Over a prolonged period of several years, some will actually then outgrow the allergy, and we can test that by stopping the food for a month and then re-challenging them. And we'll do that at 3 to 4 years down the road. But until then, they take the food every day, once a day, and then they can eat other forms of that food. So they can have their 8 peanuts in the morning and have a Snickers bar in the afternoon. Or they can have their glass of milk in the morning and have ice cream later in the day. So it provides them the opportunity to safely eat these foods without a major concern.